Have you ever noticed an unusual odor, discharge, or discomfort and thought about what might be happening down there? You were not alone. Millions of women out there experience this, and most of them do not usually talk about it. In this video, we will be breaking the silence of bacterial vaginosis. Why does it happen? Is it an infection? Can it be treated? Hey guys, so welcome back to the channel. If you're new here, my name is Onyinye Vivian. I am a licensed medical laboratory scientist living in Nigeria, and on this channel we talk about health, wellness, and everything you need to know to keep you confident about what is going on in your body. First things first, what is bacterial vaginosis? Bacterial vaginosis, commonly called BV, is a vaginal infection that occurs when there is an imbalance in the natural bacteria dwelling inside of the vagina. Now, your vagina is like a home to the good and the bad bacteria. The good bacteria, which is also known as the Lactobacilli, plays important role in making sure that it keeps that place down there healthy, and it also maintains the vaginal pH at a slightly acidic level. Now, here's where the problem actually comes in. When a number of the harmful bacteria outgrows the number of the good bacteria, bacterial vaginosis occurs at this point. Also, it might interest you to know that bacterial vaginosis is not a sexually transmitted infection. However, certain sexual behaviors can increase your chances of getting this infection. Many women who experience bacterial vaginosis don't even notice any symptoms at all. But for those women who do, the signs are quite noticeable. And what are these signs? Most of the signs that come alongside the infection include symptoms like a thin grayish-white vaginal discharge, a strong fishy odor, especially after sex, vaginal itching or irritation, burning during urination. If you are experiencing any of these symptoms, then it is important that you do not self-diagnose. You should visit a healthcare professional for a proper diagnosis. What even causes bacterial vaginosis? Before then, I would like us to look at some risk factors that can contribute to disrupting the imbalance of the natural bacteria that is present inside of the vagina. The first one is douching. Guys, this is the main culprit. I've seen a video of a girl who used a hand shower with water running out of it with so much pressure, and I don't know what she was probably thinking. She probably felt that the pressure from the hand shower, with water running out of it could maybe wash off her vagina so clean or extremely clean. But this is actually very harmful, because the more you're doing that, you are at the same time washing off healthy bacteria that could be very, very useful to your vagina. So douching is one major culprit that has landed people into problems, into the situation, bacterial vaginosis, without their knowledge. Please avoid using this method thinking that you can wash off bacteria from your vagina. It is not possible, to achieve such, it is not healthy for your vagina, because the more you do that, the more you wash off healthy bacteria from your vagina. The second risk factor is having new or multiple sexual partners. If you indulge in sexual activities with a new partner or multiple partners, you are doing yourself more harm, because at this point you are introducing more bacteria, new ones into your vagina's environment. So if you're having a sexual partner, it is advisable to just have one if you want to, or you abstain totally from sexual activities if it pleases you. Using scented soaps, sprays, or deodorants can also contribute in disrupting your vagina's pH. Wearing tight or unbreathable underwear can create a moist environment. And trust me, this is where these bad bacteria loves to grow. So another risk factor is smoking. I know most of you might be wondering how smoking can affect or cause one to have bacterial vaginosis. Well, I must tell you that smoking does its own bad effect, by reducing the amount of good bacteria that would have been present inside of your vagina. So it kind of reduces this lactobacilli, which would have helped, in keeping your vagina very healthy. Now, aside this, smoking also tampers with the immune system. It weakens your immune system, and once it does that, there is a slow production of these good bacteria that would have been helpful in the body. Now guys, the good news is that bacterial vaginosis can actually be treated. Yes, it is very treatable, but you must first ensure that you meet with your healthcare provider or your doctor, and they could prescribe some medications or antibiotics, oral antibiotics such as metronidazole or clindamycin, or even vaginal creams or gels that can help you in your healing process. But the most important thing that you need to do is that you consult with them first for proper guidance. And guys, I would like to point out one important thing as well, because I've seen most people do this thing and it is actually not helpful. It is very, very not helpful. So, in most cases, I have seen people who begin treatment, especially in cases like bacterial vaginosis, and they begin their treatment, and somehow they notice that the symptoms have gone away. But at this point, you are not meant to stop your treatment. You're not meant to stop taking whatever drug that your healthcare provider must have recommended for you. Whatever time and dosage and duration you are supposed to have taken this drug, you should stick to it. You shouldn't say because you have started the drug and you no longer see these symptoms anymore, then you decide that okay, it's better you stop. That way you are doing yourself more harm, because this infection can still come back again. Why? Because you have not completed the exact duration that you were supposed to have taken this drug. So it is very important that you finish your full course of treatment by taking your drugs appropriately. And you should also not try to take alcohol, especially when you're taking some medications like metronidazole. I'm sure your doctor would warn you about this. So if you're on certain medication, you should please avoid taking alcohol. Let's talk about prevention, because keeping your vaginal microbiome healthy can save you a lot of discomfort. Now, the first thing that you can do to prevent this infection is to avoid douching. Your vagina itself is self-cleansing. So you do not need water, you do not need any liquid substance to be able to wash off any bacteria that you feel may be present inside of you. No, your vagina itself can clean itself on its own. So it is self-cleansing. So it is very important that you avoid douching. The second preventive tip is by using gentle or unscented products on or around your vulva. You shouldn't go ahead to use scented products or scented soaps around that area. So for you to prevent this infection, please use unscented soaps or whatever kind of product that is mild or gentle around your vulva area. And you need to also wear breathable underwears. Most people like to, wear tight clothes, very tight clothes, and it is not healthy for your vagina. You need to you need to let air pass through that place. So please guys, use or wear, free underwears, and also avoid staying in wet clothes for too long to avoid growing the bad bacteria that could end up being harmful to your vagina. Limit sexual partners and also practice safe sex. And also, when using the bathroom, you should learn to wipe from the front to the back and not wiping from the back to the front. That is what most people do. They make mistakes. I don't think some people do not know how to, clean up themselves in the bathroom. Most people wipe from back to front, which is very bad. So the ideal and healthy thing to do is whenever you use the bathroom, you should learn to wipe from the front to the back, especially as a woman. You can also consider the use of good probiotics that are especially designed for your vaginal health. These probiotics can help to maintain a very good pH level for your vagina and also support the growth of the good bacteria that is present inside of the vagina. And finally, do not ignore the signs that your body gives to you. Pay close attention to your body. If you also notice some unusual symptoms such as odor from your vagina or some unusual discharge, then you should consult with your healthcare provider. Do not try to carry out a self-treatment on yourself, feeling that you might be having bacterial vaginosis. It is best that you consult with your healthcare provider, because most people might want to carry out self-treatment on themselves, feeling that they might be having this infection. Yeast infection and bacterial vaginosis is quite different from each other. They are very different from each other and they both require different treatments. So it is best that you visit your healthcare provider or hospital to carry out a laboratory test and diagnose whatever the problem might be, so that proper health care can be given to you with proper treatment. So just like we said guys, bacterial vaginosis is quite treatable, it's very treatable, and if left untreated, It can also result to pelvic infections, pregnancy complication, and the risk of STIs. So it is important that you try to get yourself treated if diagnosed with such. So guys, that's it for today. That's everything you should know about bacterial vaginosis. If you learned anything new today, please hit the like button and subscribe to the channel for more health tips. And if you've had experience with this particular infection, please you can share your experience with us in the comments section. Let's normalize talking about these problems and not hiding it as most people would want to do. You can share your experience in the comments section, and I'll see you guys in my next video. Bye.